presenter today is Károly Illy. Károly Illy is a pediatrician in the Netherlands. Is a pediatrician in the Netherlands. From 1994 to 2023, he worked as a pediatrician at the Riverland Hospital in Tiel. In addition to being a pediatrician, he was also a member of the management team at this hospital for 8 years. He was a CMIO and a medical specialist in patient safety. In 2008, he completed the executive MBA at the prestigious Business School, Netherlands. And from 2016 and 2023, he was chairman of the Dutch Association of Pediatrics. And in that capacity, a member of the Outbreak Management Team, OMT, from April 2020. Currently, is the CEO of Lung Funds, a fundraising and patient organization regarding lung health. Ladies and gentlemen, I would like to welcome our colleague and a great graduate of this institution, Dr. Károly Illy. You are welcome. Before he speaks, let me quickly spend a minute to introduce the reflector. The reflector today is Dr. Femi Omololu, the medical director and CEO of Lagos Island Maternity Hospital. This hospital is the single biggest hospital for childbirth. They record the highest childbirth of any hospitals in this country since independence. It's a consultant O&G obstetric and gynecologist at the historic Lagos Island Maternity Hospital, appointed medical director in 2019, a position that he occupies to date. He also obtained leadership training and certification from University of Washington, Enterprise Development Center, and is currently undertaking the BSN MBA program. Indeed, he is the governor of his set. Administratively, he is skilled in strategic planning as an enthusiastic woman professional development leader. He was given a Transformational Leadership Award by the Lagos State Government in 2022. And under his stewardship, Lagos Island Maternity was recognized for its COVID-19 response by the International Hospitals Federation in 2021. Dr. Femi Omololu is an author of 2 books and is still writing more and has written several articles in various magazines. Ladies and gentlemen, I present to this group Dr. Femi Omololu, the CEO for Lagos Island Maternity. You are welcome. It's a privilege for me to run my presentation by calling on Károly Illy, who has prepared extensively for today's presentation, to take the center stage. You are welcome, Károly. Thank you.
Thank you so much, Lere, for this very nice introduction. May I have my first slide, please? Very good. One moment. May I have the next slide, please? To start, I would like to take you back to mid-March 2000. No, back. Yeah, right. Thank you. On Sunday, March 15, Prime Minister Rutte announced that everything must close in the Netherlands. The catering industry, the shops, the schools, everything. At the end of March 2020, the importance and influence of the outbreak management team became increasingly clear to me, especially because I noticed that this OMT also gave advice that influenced the lives and well-being of children. And I think it's good to note here that I was, at that moment, the president of the Dutch Association for Pediatrics from the end of 2016 until mid-2023. In any case, one look at the website of this OMT was enough to see that the OMT had many experts, but no one with knowledge of children. Next slide, please. Coincidentally, I already had the mobile number of the chairman of the OMT. His name is Jaap van Dissel. He is the one on this slide. And at the end of March 2020, I called him and asked him whether it would not be wise to have a pediatrician participate in the OMT. He immediately agreed, realized that this would have added value, and immediately invited me to the next meeting that week. Since then, I haven't missed a single meeting every week for 2 years. The documents for the meetings were always sent the day before. This meant planning Thursday evening to read it so that you could be well prepared to discuss it on Friday morning. Meetings that normally lasted 3 to 3.5 hours. Always online, never physically. We had a reunion in mid-2022, and that was the first time I met my fellow OMT members. I didn't know most of the OMT members at all and never met them in those 2 years. Always online, always via the screen, always like this. Next slide, please. That brings me to the composition of the OMT. During most meetings participated 9 medical microbiologists, virologists, 8 infection control doctors, 4 internist infectiologists, 3 geriatricians, and 1 intensivist, 1 general practitioner, 1 occupational physician, 1 doctor for disabled people, and 1 pediatrician. That's me. So a lot of microbiological and infection control violence, in total 17 men and women, and relatively little medical practice. Such a composition naturally has impact on the way in which a meeting takes place. If 9 microbiologists all proclaim one way of thinking, always in slightly different words, and 1 pediatrician another, then it needs a very, very good chairman to give equal value to all. And that is where the miracle of the OMT occurs, and that is Jaap van Dissel. That's the guy on the right. The right man in the right place. It requires a lot from the quality of the chairman to properly lead such a digital meeting and arrive at good decision-making. Jaap thought it was very important that different perspectives were highlighted. For example, I often didn't have to ask to speak at all if it had anything to do with children or young people. Jaap often asked my opinion in advance. So I was happy with Jaap, but Jaap was not always happy with me, because in addition to being an OMT member, I was mainly president of the Scientific Association for Pediatrics. In those 2 years, I have been invited frequently as a guest talk in a talk show and been interviewed for the evening news. But I was never announced as president of the Dutch Association for Pediatrics, always as member of the OMT. And then it has indeed happened a few times that I expressed an opinion about, for example, our objection to closing schools, while the discussion in the OMT had yet to take place. Those were the moments when I received a phone call from Jaap the next day. He reprimanded me and I apologized, which were also invariably accepted immediately. Of course, Jaap also realized that I also had another responsibility and sometimes used the media to influence politics. Back to the OMT. It might be nice to talk about what the structure of those meetings was like. It always started with approximately 1.5 hour long slide presentation with the current epidemiological state of affairs and the associated models. Between 100 and 150 slides, every week again. The slides always had the same format, so we could see the trend week in, week out. I will show a few pictures to show what kind of information we were presented with. May I have the next slide, please? Every week, Every week we received an update of the Apple mobility trends. Here you can clearly see the influence of the acute lockdown in the spring of 2020 and how the Netherlands behaved afterwards. Next slide, please. The reproduction number was, of course, depicted in various ways. Here you can see which variants have affected us and how they have displaced each other over time. Next slide, please. And finally, also not finally, because it was between 100 and 150 slides, but finally in this presentation, I will show you the reproduction number per safety region in the Netherlands. Green is significantly below 1 and red is significantly above 1. It is easy to see how quickly the virus spread at the end of 2021. In 2 weeks, from almost everything green to everything red. Clarifying questions could then be asked, and the ministry's questions were discussed. In fact, the ministry's questions were almost always about potential relaxations and restrictive measures. In addition, OMT members after consultation with Jaap, of course, could take the initiative to introduce additional agenda items. I was one of the few who took advantage of this. But in this way, I was able to put various relaxations on the agenda for children and young people. For instance, children's sports, summer camps, and swimming lessons. Regarding the latter, thanks to the OMT advice on this matter, swimming lessons were no longer regarded as a sport, but as an educational activity. And that was why it was able to start early in 2021. May I have the next slide, please? When I talk about the presentations and discussions, the longest discussions were by far about the so-called models. And to show what such a model looked like, this picture. It's not just any picture. It is the picture from the OMT meeting of December 17, 2021. Delta has not left yet, but Omicron is on a very rapid rise. And based on the figures available, this model is presented. A shock goes through the OMT. If this is realistic, we are heading for a disaster with numbers of occupied ICU beds that we do not have at all. But at the same time, there is doubt. Is it correct? Isn't it too pessimistic? Because the first signals are now coming from South Africa. Omicron appears to be much less pathogenic than Delta. I don't remember ever talking about one picture for so long, and this OMT meeting ended up lasting more than 4 hours. Looking at this picture, I challenge you, have the courage to say that it probably won't be too bad. A devilish dilemma, partly because it is becoming increasingly clear that the measures also cause significant, especially mental, damage. Based on the OMT advice, the Prime Minister announces 1 day later that all schools, all shops, all catering establishments, the cultural sector and sports clubs will close immediately. Membership of the OMT publicly standing up for children and promoting vaccinations also has a downside. I'm going to share with you a dark side of our society. These are some of the hundreds of hate mail, hate Twitter messages, and hate LinkedIn messages. May I have the next slide, please? No, there's one in front of it.
Yes, I removed that one on advice of Annette and in discuss with you.
No, it was, I don't understand. It was only one text that was out.
Oh yeah, we took the whole slide out, which was on the side of the next to the picture.
Oh, you took the whole. I thought only that single.
Sorry, you can just talk without a slide, please.
Okay. Well, anyway, so I will then phrase some of the messages that were sent to me by mail and LinkedIn. I promise you that I will work until my last breath to have you imprisoned for at least life for treason and crimes against humanity, including child abuse. You will have to answer at Nuremberg 2.0 tribunal and be convicted. Unfortunately, I must equate you with Nazi doctors. Dozens of lawyers are already preparing a case against you. This dangerous lunatic belongs in jail. This goes beyond Dr. Mengele. Against the wall. And in the spring of 2021, on a Sunday afternoon, 3 men suddenly stood at my door. In that picture, you could see 2 of them with 2 rotating cameras. They came to congratulate me because I had won a prize, the Anton Mussert Prize. Anton Mussert was Adolf Hitler's guy in the Netherlands, and the video, which shows the street and house where I live, was put on YouTube with the somewhat frightening text, "Look, this is where he lives, the proud winner of the Anton Mussert Prize." Still, I don't want to end on a sad note. There is also positive bycatch, certainly positive for the Dutch Association for Pediatrics. As an OMT member, I was not only an interesting discussion partner for the media, but also for politicians. And some of the politicians you see here on this slide. And politicians were also interesting for me. During those years, I was able to consult frequently by telephone with ministers and members of parliament. All those mobile numbers are in my iPhone. Of course, I don't abuse it, but I do use it. An example, the decision of the Ministry of Health not to include the rotavirus vaccination in the national vaccination program. I can then very easily call a few MPs to explain why this decision is so unwise and provide them with the correct information for the parliamentary debate with the Ministry of Health. And with success, the Minister of Health ultimately included the rotavirus vaccination in the national vaccination program. I have tried to convey how difficult it can be to make decisions in uncertain times and how difficult it can sometimes be to weigh the risks. I have also tried to explain how useful it can be to maintain good contact with the media and with politicians. It can determine the degree of influence and therefore the impact on society. Thank you very much.
Thank you so much, Károly, for a very beautiful presentation, timely as well. Really appreciate the professionalism that have been demonstrated. It's time now for Dr. Omololu, the reflector, to share his perspective on the same topic. Dr. Femi Omololu, over to you. On mute.
Okay, yeah, thank you.
Thank you.
Okay, good morning, everyone. Thank you, Károly, for your presentation. I'll just be sharing our experience at the Lagos Island Maternity Hospital during the pandemic. I think the first thing that you need to be able to anticipate change and, know that the crisis is coming, because when in May we heard about the pandemic coming up, I mean, we had seen what was happening in the Western world and we knew we had to prepare for, what was coming. So the first thing we had to assess, what are the risks we are going to face? There was going to be risk to our finances, risk to our operations, risk to our clientele, risk to our personnel, because COVID presented not just a health risk, but also a business risk. And we had to look for how we are going to address, all these risks. So the first thing we did was to, set up a management team that was going to set up a committee that was going to look into how we are going to attack the pandemic. We had done this beautiful strategic plan for the year 2020 at that point in time, but we had to discard that and then re-strategize because, you have to be flexible when you are facing this kind of challenge. And we had to come up with different teams made of, different heads of departments, different heads of units to address different challenges, to address the staff, to address our supply chain, to address how we will manage patients and, manage our infection control. Information management was also very key because we needed to be continuously communicating with our patients and our clients. More than ever before, we got our website very active and we started using social media as well to communicate with our patients and also with the general public. WhatsApp is very popular in Nigeria here. So we had to develop WhatsApp group for our patients through which we were doing a lot of trainings and, educating them on what was going on and what to expect when they came to the hospital. We also did that to our staff as well with weekly communications to them to let them know what was happening. Of course, the management team the response team was having meetings every week as well, not with 150 slides like Károly's team, but, just generally targeting what we had to do. We also conducted surveys which were sent to clients to assess their perception of risks, and then also to our staff to assess the management's response to the pandemic. And this information was used to modify our strategies, and it also created a reassurance to the patients as well. We also had to modify our service delivery because of the lockdown and the restriction and people's fear of coming to the hospital and even fear of the staff from getting infected with people with COVID-19. So we had to modify. So we had to set up some kind of telemedicine, create access line for clients, give longer appointments to low-risk patients, do shorter hospital stay with a faster turnaround. So that helped us to maintain services, at reduced risk to everyone. Capacity building was very important because we had to train staff in infection prevention and control and management, and we also had to do lots of trainings and do judicious use of data. Staff engagement and motivation was also very key. Like I said, we had weekly messages. We had to support staff with transport to hospital during the lockdown, provide moral, financial, and emotional support for staff who were infected. In every crisis, there's an opportunity, so you also have to seek out those opportunities. At the time, the governor declared free health for all the people of Lagos State. And because we had created robust systems in the hospital, and we were able to keep going, and we got the most remuneration, from the government for that, because we saw more patients and did more surgeries than any of the other 30 state hospitals. We also started producing hand sanitizers within the hospital for internal use and for sale. And we're also able to present what we did to the International Hospitals Federation and got recognition for it, which also, served as a form of marketing. So some of the learning points from the pandemic for us was to need to know how resilient your business is, do a strong SWOT analysis, do a risk assessment of your business, make sure your business is flexible, you must be willing to re-strategize. Digitalization was key. We came up with lots of things like non-contact equipment used to manage patients. Information management was critical because that helped us to manage the situation and manage people. And I think overall, the pandemic taught us how to move from fear to learning and to growth. Thank you.
Thank you so much for a very wonderful reflection. I think Károly and Femi had succeeded in educating us. It's now time for Q&A. Please go to the chat room to ask your questions or raise up your hand electronically. And the chief host will call on you to make your presentation. Very important. In summary, these people have been able to share with us how they confronted in a period that was filled with disruption as a result of COVID, how they confronted the problem with direction. They confronted volatility with vision. They confronted uncertainty with clear understanding and with capacity building. They confronted chaos with clarity of communication. They were able to confront ambiguity with agility and flexibility. They confronted risk with resilience. And rather than run away from diversity, they embraced diversity through engagement. And ladies and gentlemen, these are the leaders who have been able to manage using decision leadership in a period of crisis, in a period of chaos, in a period that nobody prepared for. As leaders, we need to be prepared. So can we start to have questions questions that we can actually start to raise to these people for better understanding? Any question? Let's see your hands. You raise your hand, we call on you, or you put it in the Q&A box and we'll read it out. Any question? First, let me start with my question, Károly. Looking back, you did not prepare for this, for COVID when it came up, and you were called upon to provide leadership. Looking back, are there things you would have done differently if there were to be another pandemic? God forbid, there to be any reason for something similar to that to happen, and you are provided a leadership role like you were provided that time. Are there things you would do differently?
Thank you for this question, Lede. And indeed, the main thing I would have done differently would be regarding the measures that were taken in my country regarding adolescents and young adults. I think we underestimated, at least in the first year, the amount of damage, especially mental damage, that has been done in their direction. And I think in a future pandemic, we should be aware of this damage, and we should look at measures that will not influence their the way they can behave and the way they can move around in our society as harsh as we did now. So I think the main lesson I have learned is how to actually to differentiate in society between, for instance, the elderly and the adolescents and young adults.
Fantastic. Thank you. Dr. Omololu, what's your perspective on this? On the same question, is there anything you will have done differently given the same opportunity to provide leadership in Lagos Island maternity in a period of pandemic?
Well, it was actually very interesting because at that point in time, I was only about 8 months at the helm of affairs at the hospital. So it was quite a huge challenge having to deal with this. And given the uncertainty at that time, which was all over, because we're all learning, within the country, it was like nobody really, knew it all. But what I may have done differently was to probably give a lot more attention into managing the staff, because within the hospital, the health risk was real. And, a lot of anxiety, a lot of people didn't even want to come to work at that time. And it was very difficult trying to balance keeping services going, and which is basically, running the business or doing the work, and having your staff willing to, take up the challenge of seeing patients. I think we were able to manage it fairly well. And overall, in the big picture, I think we are quite lucky in Nigeria that the pandemic didn't really become, fully blown. But there are so many lessons we were able to gain from it. We learned so many ways of doing things differently. For instance, Lagos State has terrible traffic, and we never knew we could use Zoom meetings, virtual meetings, instead of, having to come for physical meetings. We never knew people could work from home. Some people could work from home, and, all those lessons were really well taken up within our environment. Thank you. Thank you.
Károly, are there lessons on decision-making leadership that you will say you experienced during the Corona time, which you took along with you to new leadership roles that you are in now? And what advice will you give to all of us here when we make decisions in our organizations? Károly.
Actually, the main thing would be that in future, I would be more persuasive in the direction of the OMT chair to implement, for instance, I would have used my leadership and my presidency of the Dutch Pediatric Association to include also knowledge and experience from psychologic and psychiatric background in the OMT, because that was actually lacking. And you must understand that in the beginning, I was confronted in this Zoom meeting with all kinds of professors, all kinds of very highly respected, scientifically respected colleagues. And I was a bit modest, and a bit, I didn't dare to challenge this, but basically that was actually wrong, because basically I had to speak up and use my presidency to convince the others how important it is that also the mental knowledge, in this case psychological and psychiatric knowledge, would be implemented and included in the OMT.
Thank you so much, Ray. We just have 1 minute, so will you be able to just confirm to us who was the major decision maker? Was it the political authority or the medical authority?
Well, that is interesting. In the beginning, the government simply took everything the OMT said for granted, and in the beginning, the government did not challenge or did not in any way not include the advices that were given by the OMT. But that changed. And also the whole atmosphere in the country changed, where the OMT was challenged by different people in the country, whether they gave the good advices, also regarding vaccinations, for instance. So it is it changed over time.
Thank you. For a few seconds, Femi, how will you say what is the process adopted in the meeting, in your meetings, to take decision, either X or Y decision, in view of political interventions? Femi, just for 30 seconds, yeah. On mute.
Yeah, sorry, thank you very much. Well, for us, being a government organization, we are really hamstrung by political decisions, really. But being clinicians too, and this was a medical, it was a health problem as well. So we had to take a lot of decisions based on evidence-based practices, related to health. For instance, the judicious use of PPEs, because some people wanted to go full overboard, and there was a problem with supply chain of consumables. So we had to restrict some of those things and, make people understand why we had to do some things, do some things differently from a medical perspective, and not just for political reasons. Thank you.
Thank you. We would like to thank the entire audience for attending this program. Decision-making leadership is a period as well of adding value, and it's an opportunity for leaders to be able to show clear direction and show light as to what needs to be done. Particularly in a period of pandemic, there's no time. We don't have sufficient time to weigh the options, and leaders need to take the right decision to keep things going. The two major people who have played very key role in a period of pandemic have spoken to us today. And we do hope we have a couple of things we've learned from this decision-making process by them during a period of pandemic. We'll have been able to understand how they were able to show greater level of awareness and share that level of awareness with more people. They look at the science of the time. They look at what needed to be done using science and technology trends, and they were able to use robust analysis to even convince politicians as to the right decision to be taken. So over a period of time, science prevailed and leadership also prevailed. Ladies and gentlemen, we'd like to thank you as we prepare from today again for the next week. Next week, we will be having the Goodmorning BSN. You can, we'll be able to have, it's about responsible leadership for next week. Theo Winsma, as well as John Lampas from the Reputation Academy, will talk to us about keeping up a good reputation, a license to operate. And so it's going to be an interesting topic where the discussion about our reputation management, not just for individual, but also for organization. And that will be addressing responsible leadership. In a period when the world is filled with so much interventions from hackers and so on and so forth, the image of our organization and of individual can actually become a major thing. And brand management has become the major thing. So reputation management as an integral part of brand management is critical. Ladies and gentlemen, we'd like to say a big thank you to all of you